Good evening, guys.
Good evening, ma'am.
Good evening, ma'am.
Good
Good
evening,
evening,
ma'am.
madam.
Good evening, everyone. So today we will discuss about basics of medical coding. Okay. So what is medical coding? Medical coding is a transformation of healthcare diagnosis, procedures, medical services, and equipment into universal medical alphanumeric codes. So what they are doing, they're transforming healthcare diagnosis, they in the sense medical codes, okay? They transform healthcare diagnosis, procedures, and medical services and equipment into universal medical alphanumerical codes. So what is the main reason for reporting these diagnosis, procedures, and medical services and equipment into alphanumerical codes in order to get reimbursement from the insurance companies? So as US people, they are having health insurance policies, right? So whatever the services they are rendering from the doctors, whether that is a diagnosis service or procedure service, whatever it is. So their respective insurance companies, they are paying reimbursement to the doctors or hospitals. So coming to medical coding, we are doing this medical coding for provider and facility. Provider coding and facility coding. Provider coding is nothing but doctor coding. Facility coding is nothing but hospital coding. So whatever the alphanumerical codes that we are reporting, right? So when we are working for provider coding, so whatever the alphanumerical codes that we are reporting, right, that bill is going to doctors. That is provider coding. And coming to facility coding, so whatever the alphanumerical codes we are reporting, right, that bill is going to hospitals. So when you're getting a job in any medical coding company, they will be informing you whether you guys are working for provider coding or facility coding. So, and there are main two types of medical codes used in medical coding. What are they? Diagnosis codes, D codes, and procedure codes, P codes. So, diagnosis codes are used to describe the medical conditions that patients are being treated. And procedure codes describe the medical services that are being provided. So example, if patient is having any diagnosis like diabetes, hypertension, fever, or acute back pain, severe back pain, whatever the diagnosis, if he is having, right? So for that services, for that conditions, if he is getting treatment from the doctor, so we have to report that with the D codes, which are nothing but diagnosis codes. So coming to procedure codes, whatever the procedures he is undergoing, like appendectomy or biopsy or endoscopy or trigger point injections. So this and all comes under procedures. So for this, we have to report procedure codes. And coming to coding, types of codes and manuals, what are the manuals we are using for this medical coding? So ICD 10CM codes, CPT codes, and HCPCS codes. So these are the three manuals. So we have to study about these three manuals in order to work as a medical coder. So you may get job in any of these departments. Okay, for ICD department, CPT department. So coming to ICD 10CM codes, again these are the three manuals. Okay, so this is third module, fourth module, and fifth module. So these are the modules we're having for CPC exam, and these are the manuals or modules that we have to follow when we are reporting diagnosis code or procedure code when you're working as a medical coder. ICD 10CM code, CPT codes, and HEPICS, HCPCS codes. So we will discuss one by one each. So coming to ICD 10CM codes. So the abbreviation for ICD is International Classification of Disease 10th Revision Clinical Modification. So ninth revision also there, but as if now we are not using that manuals in order to report diagnosis codes. So 10th revision we are using this manual we are using in order to give or report diagnosis codes. 11th module also the 11th revision is there, that in future we may use that manual for reporting this diagnosis codes. As of now, whatever the manuals we are using, right, that is 10th revision only. So international classification of disease, 10th revision clinical modification. So these codes describes a patient's diagnosis, symptoms and conditions. So this manual consists, so this was last figure, because these manuals are getting updated every year. So updated in the sense, if any new codes they want to add, that they are adding in the manual. If they want to delete any old code, they will delete that codes from the manual. And if they want to do any revisions or guideline changes in specific chapters, that they will do. So one organization will be there. That is the organization who is updating all these things. So currently we are having in ICD 72,000 codes. Okay. ICD manual that consists of 72,000 codes and allows more specific classification of disease. So it is not like that we have to remember all that codes. No one will remember 72,000 codes, right? So the process I will be explaining you how to read code from these manuals. So if you see, this is ICD manual. So as I said, this is the open book exam, right? Not only exam, when you're working as a medical coder, there also you have to get codes from these manuals only. You have to use these manuals when you're working in industries also. Then ICD-10 index to disease and injuries. Okay, from alphabetical letters A to Z. Okay, whatever the diseases are there with these letters from A to Z, injuries, not only disease, injuries, signs and symptoms. These codes we can get from this index from letter A to Z. So like this 72 codes are there, 72,000 codes are there as if now. Okay, that number will increase or decrease. So just you can tell me any disease that starts with letter A.
Appendicitis, abdominal pain, anxiety.
Okay, appendicitis, anxiety. Okay, so now you have to get that alphanumerical code for anxiety. Okay, we'll go with anxiety. So we have to go to A. This is A letter, right? So we have to go to alphabetical index A. Under A, we have to search anxiety. So anxiety we are not getting from this index under A-N-E, right? A-N-E, anxiety. So now anxiety comes under disease, right? Now you have to go,
Anemia.
wait, we'll see for anxiety only. So now you have to go to D. Under disease, you'll see, you will get anxiety. If you're not getting from that index, so now you have to go and search under disease. Disease, right? Under disease, now you have to see anxiety.
ANX.
It's okay.
Ma'am, can't we search directly?
Like how?
I mean, is there any search option that we can put the name and then it will highlight it in the
No,
menu?
no, it's not like that. You have to go through the index only. Okay, then under disorder, you can see if you're not getting under disease, then you have to check under disorder. You have to take these hard copies, right? In hard copies, how you will use that search option?
Yeah, right.
Disorder is there. Yeah, disorder. So under disorder, now you can see anxiety.
Is
Is
Anxiety.
there anxiety is above F43.22 in the middle column? Yeah.
Distance. Disorder, anxiety, F43.4, F43.22. Okay, so like this, you have to search codes in this index. So whatever the conditions doctor is documenting, right, that codes we have to get it from the alphabetical index. So in ICD, we are giving codes to diagnosis, injuries, signs and symptoms, and disorders. So this is another example, okay? So E11.9, that is the alphanumerical code for type 2 diabetes. So now you have to go to D, diabetes, right? So under D, you have to see diabetes. Then next you have to search under D, diabetes type 2. Diabetes. So now we have to see type 2. So in diabetes, types are there: type 1, type 2, diabetes due to drugs, diabetes due to underlying condition. So here it is type 2 diabetes, right? So diabetes, this is type 1, and type 2, 11.9. So this is the alphanumerical code for diabetes. So next, asthma, unspecified, J45.909. Again, you have to go to A. Under A, you have to see asthma. So you'll be getting echo. So J45.909. So like this, you have to search codes for the diagnosis from ICD manual. So, and this manual is updated and managed by WHO, World Health Organization. In the US, the NCHS, National Center for Health Statistics, which is a part of CMS. CMS is nothing but this is the insurance, federal insurance policy. It is there for US citizens. So, Centers for Medicare and Medicaid Services. So, it is a government insurance company. Oversees all changes and modifications to the ICD codes in cooperation with the WHO. So, and these ICD codes are updated on October 1st every year. So, every year this ICD manual that is getting updated. So, updated means any new diagnoses are developed. So, for example, coronavirus. So, before 2018, before 2019, example in 2018 or 2017, there was no corona code in this manual. This is ICD manual, right? So there was no corona code because that time that disease was not there. In 2018, 2017, corona is not there, right? So that came in 2019. Again in 2020. So as these ICD manuals are getting updated on October 1st every year, right? So in 2020 on October 1st, after that, a corona code was added in this manual. So that code comes with the user 7.1 that was added in USIL under alphabetical letter U. So there it was added. So like that, every year on October 1st, they will be adding some new codes, which means any new disease they have come across or they have new disease it has raised. Okay, they will develop a code, alphanumerical code for that, and that code they are incorporating in the manual. So likewise, the old codes they will be removing from the manual. Suppose some conditions are there. That conditions currently people are not facing or not occurring. So that type of codes they will remove from the manual. Or they want to change any guidelines. Okay, so guideline in ICD 22 chapters are there, right? So they want to add or they want to revise any guidelines. That thing they will do. So that is nothing but updations. So what is the organization that is doing these things for ICD manuals? WHO. And that is on October 1st every year. So from first module, I think I have explained you, right? How many modules are there for this program?
Yeah, yes.
5 modules, right?
5, yeah.
5
Five
modules, ma'am.
So the first module is medical terminology. So from that, so we'll get 4 to 5 questions. So this is also comes under medical terminology. So from this topic, this is important question. What is the organization that is updating ICD manuals and when? WHO is the organization and that is doing updations to this manual on October 1st every year. And next is CPT. CPT means what? Current procedural terminology. These codes cover medical services and procedures performed by healthcare professionals. Healthcare professionals are nothing but doctors and other qualified assistants. So again, the CPT codes are classified into 3 types, 3 categories. Category 1, Category 2 and Category 3. So in CPT Category 1, so the alpha, it is like the numerical codes we are reporting for the procedures and services done by the doctor. So procedures means, as I said, right, any appendectomy or lobectomy or biopsy or laceration or suturing or the fractures to the treatment, whatever the procedures, right? So for that services, and services like example in OP visit. Okay, so example patient is having severe appendicitis. This was the reason for going to the hospital. So he's going he's going to OP visit, outpatient visit. So where he is getting some treatment for his problem, right? So for that services also we have to report this category 1 codes. So one example is the 99213, that is office or other outpatient visit. So category 1, usually we are giving codes. CPT category 1, we are giving codes for procedures and services. Next, category 2 codes. So these codes we are reporting for performance measurement. Okay. Example 10367, sorry, 36F. This category 2 CPT codes ends with the letter F. 5 numericals but ends with the letter F. So this is the code for smoking cessation. So which kind of services we are reporting this category to? So performance measurement is nothing but example, patient is having severe chest pain. That was the reason for encounter to the hospital. So he is going with this problem where doctor is asking him, you have to take chest X-ray. Okay, so he's advising some X-ray or whatever the advices that we are getting, that patients are getting from the doctors, right? For that kind of services, we have to report this CPT category 2 that comes under performance measurement. So the CPT category 2 code ends with the letter F. And next, CPT category 3 codes. So these codes we are reporting for emerging technologies. These are temporary codes. So emerging technologies are nothing but during any procedures, they will be using some technologies, right? So for that technologies also we have to report codes. That is what CPT category 3 codes. Example 0123T. And this category 3 codes ends with the letter T. This is the example for transcatheter placement of an endovascular stent graft. So this catheter is an instrument. They are placing this catheter during this endovascular stent graft procedure. So for emerging technologies, we have to report CPT category 3 codes that ends with the letter T. And for performance measurement, we have to report CPT category 2 code that ends with the letter F. And procedures and services, for this we have to give CPT category 1 codes. So, and again, these CPT codes are developed and maintained by AMA. That is American Medical Association. This is the organization. This is maintaining this manual. And these CPT codes are updated on January 1st every year. So AMA is the organization that is doing updations to CPT manual. That is when January 1st every year. So for this year, the CPT manual got updated for 2025 year. What is this month?
August.
August.
Yes, madam, updated.
October month.
It's got updated, right? CPT, I'm not talking about ICD. CPT manual. So this is ICD manual.
First.
So twice. This is CPT manual. This is
January.
CPT. So this manual,
January.
CPT manual is getting updated by AMA on January 1st. So today is what? August 4th, right? So this CPT manual got updated or not for this year?
Yes. For this year,
Updated, ma'am.
It's got updated.
Updated.
Okay, it's got updated. But for ICD, still time is there because that is updated on
On
October
October.
1st every year. So still 2 months of time is there. So after October 1st, again, some updations will be there for that ICD manual. And next manual, that is HCPCS. So coming to this abbreviation, Healthcare Common Procedure Coding System. And these codes are used for services, supplies, and equipment. So usually HEPICS codes are divided into 3 levels actually. In detail, we will discuss when we're having these manual updates. Okay, so out of 3 levels, the third level currently we are not using, we are not following that guidelines in order to report the codes. Only level 1 and level 2 we are using. So coming to this HEPICS levels, level 1 and level 2. HEPICS level 1 and HEPICS level 2. So HEPICS level 1 is nothing but CPT. Okay. So HEPICS level 1 is nothing but CPT. CPT means what? There we are giving codes to the procedures and services. Again, CPT is classified into 3 categories. Category 1, 2 and 3. And coming to HEPICS level 2, here we are reporting codes to the durable medical equipment and prosthetics and ambulance services and other non-physician services. So example, one patient is got admitted into the hospital where he is taking saline. Okay, where he is taking saline. So the administration of saline that is done by nurse, right? So nurse also she should get some bill. And the saline bottle that comes under uh, product, right? So for that product also patient should pay bill, right? Here patient is not paying because he is having some insurance policies that insurance company is giving reimbursement. So this level 2 codes we are reporting for coding durable medical equipment. So example, she is undergoing some ventilation. So she is having acute respiratory failure where she cannot able to breathe by herself. So she got admitted into the hospital where she is on mechanical ventilation. Some machine is there. With that machine now she can able to breathe. So for that machine also we have to pay money, right? Because we are taking treatment with that machine. So we, in the sense, insurance company is going to pay that amount to the hospitals. So for that type of services we are reporting HEPICS level 2 code, durable medical equipment and prosthetics. Example, any implants are done. Like a patient is having breast cancer, for example. So that is where the patient is in her 4th stage. So what they had done, they have removed her breast. Due to rapid spreading of the cells, they have removed her breast. After removing again, that breast is, doctors are reconstructed with some implants like silicone breast. They implanted silicone breast. So for that, now here they have implanted some prosthetic devices, right? So for that services also we have to report HEPICS level 2 code. And along with that, ambulance service. So some patient is having, someone is met with severe accident where he had a lot of, he had severe head injuries. So he went into unconscious state. Okay. So in that case, that particular hospital's ambulance was going to that place and picking up that patient. So ambulance also should get bill, right? So, and other non-physician services. Non-physician means apart from doctors, like nurses, so some other technicians, from them also we are getting some kind of services, right? So for that kind of services, we have to report this HEPICS level 2 codes. Example, A0428. This is the HEPICS level 2 code for ambulance service, basic life support, non-emergency transport. And HEPICS level 2 codes are developed and maintained by CMS. CMS means what? Centers for Medicare and Medicaid Services. And HEPICS codes are updated on January 1st every year. So ICD codes are updated by WHO on October 1st every year. CPT codes are updated by AMA on January 1st every year. And HEPICS level 2 codes are updated by CMS on January 1st every year. These organizations and these dates are important. So coming to the code structures of this ICD code structure, CPT code structure, and HEPICS code structure. So if you see here, these are two diagnoses, right? Diabetes and asthma. If you see for this type 2 diabetes, this is the alphanumerical code E11.9. So how many characters are there? 1, 2, 3, and 4. For this condition, 4 characters are there, 1 alphabetical and remaining 3 are numericals. And for unspecified asthma, again J45.909. 1, 2, 3, 4, 5, 6. So for this condition, 6 characters are there. Okay. So the basic structure of ICD-10 code is up to 7 characters. Okay. So 7-digit alphanumericals. This is the structure of a ICD. So it is having 7 characters. Okay. So but not all the conditions that we have to report with the 7 characters. It is not like that. So up to 7th character we have to give. Beyond that 7th character, it is not an ICD code structure. ICD code structure is having 7 characters, which doesn't mean that all diagnosis codes will have 7 characters. It is not like that. Most of the diagnosis codes will have 5 to 6 characters. So that we will discuss in detail in the next classes. Again, each character. So this is a 3rd digit, right? 4th, 5th, 6th. Likewise, each character or each digit is having some specific meaning in the code structure that we will discuss in the coming classes. So the basic code structure for ICD is 7-digit alphanumerical code. One alphabet it will be having, the remaining are numericals. And coming to CPT code structure, that codes are composed of 5 digits. 5 numericals. If you see CPT category 1, all numericals we are having. 5 numericals. The CPT code range starts from 00100 to 99499. This is the code range. Within this code range, 6 chapters will be there that we will be going to discuss in the coming classes when we are having the CPT for the first. So that was the code range 00100 to 99499. So category CPT1 category codes, again the structure for these codes are 5-digit numericals, and category 2 5 digits numericals, but the last letter that character that ends with the letter F, and for category 3 that ends with the letter T. And coming to HEPICS level 2 code, again this is also alphanumerical 5 digits. So from A to V series. From A to V, we are having all codes for this durable medical equipments, prosthetics, ambulance services, and other non-physician services. So for these all services codes, we can see from alphabetical letter A to V in that HEPICS level 2 book. And coming to its structure, that is a 5-digit alphanumerical code. So that is about the code structure for ICD, CPT, and HEPICS level 2. And coming to the coding process, what a medical coder he will do, how he will be doing that coding. So the first thing is what? Documentation review. So for example, this is the example for a prescription format. Prescription for particular service. Okay, so example, this patient went yesterday to the doctor. He consulted yesterday to the doctor. So doctor has given that patient's prescription in this format. Okay, all the medical records, whether that is a diagnosis, prescription, or procedure prescription or HEPICS level 2 prescription, whatever it is, that prescription should be have in this format. Chief complaints, history of present illness, HPI, and current medications, and PMH, past medical history, ROS, review of systems, social history, family history, physical examination, ancillary studies, impression, and plan. So out of all these, 4 things are important: HPI, PMH, ROS, uh, and physical examination and plan. These 4 are important. Okay. If example in a prescription, example out of these 4, one thing is missing. Either it is a HPI or PMH or physical examination or plan. Okay. Out of these 4, one thing is missing. Doctor has not documented in that. So under this HPI blank, it is nothing was mentioned in this part. Under this section, nothing was documented by doctor. So we are not supposed to work on that prescription. Okay, so we have to query the doctor. What is the reason why in this prescription this HPI part is not documented by the doctor? So after getting consent reply from the doctor, then only we can process that prescription. So this kind of guidelines they will be giving you before you're working on the live records. This is one example for dummy records. So we don't get live records outside. Outside the industry, we don't get. So there was a lot of security rules will be there. So that is why we are not seeing that examples with the live record. This is the dummy record, but the format should be in this form. The prescription format should be in this way. It should have HPI, PMH, ROS, physical examination, impression and plan. These are the 4 things. So example, this is a prescription, right? The first step is what? Documentation review. So we have to read everything from this prescription. We have to understand. So what is the problem patient is having? What is the reason for coming this patient to the hospital? What kind of treatment he is getting from the doctor from this date of service? What are the chronic conditions he is having? For the chronic medications, does he is taking any medicines or not? So in past he underwent any surgeries or not? That things we have to review. So suppose this anyhow this is the CPT procedure prescription. Okay, this is not an ICD prescription, procedure prescription. So coming to this patient, he is having problem to the spinal stenosis with radicular leg pain. So this is the problem. For this problem, he went to hospital. For that, he is getting some treatment. So in this particular visit, what was the treatment that was given by doctor? Just a doctor advised an MRI scan. Okay. So he advised MRI scan. After seeing that scan reports in the next visit, doctor is going to give some treatment, whether he's giving some pain injections or epidural injections or trigger point injections, or he will be doing some procedures. That depends in the that he will discuss in the next follow-up visit. So this is the problem he is having for this in this visit. So for that visit, doctor has advised an MRI scan. So that MRI scan code we have to report. That is a CPT procedure. So so we have to read everything. After that, we have to confirm, okay, we have to conclude, okay, this is the problem patient is having. So this was a service he is getting for this problem. So here we have to report a CPT code for MRI scan. So in CPT, not only procedures. Procedure means what? He's cutting some skin, or he's doing some incision. He's going inside. He's removing a part of the body. It is not like that. In CPT, even though if doctor is advising endoscopy, if doctor is doing some endoscopy or MRI scan, he is taking any chest X-ray, or he is giving any trigger point injections, or he is doing any suturing to the laceration, or he is removing appendix from the body. These are all comes under procedures only. Okay, so here the procedure code is what? MRI. So that is the thing. After reviewing this prescription, a medical coder should give code to that procedure. So that is the first step. Documentation review. Coders review medical records to identify diagnosis and procedures. Okay. So suppose you think this as a diagnosis prescription. Actually, this is a CPT prescription. Suppose you can consider this as a diagnosis prescription. So in that case, so in past medical history, patient is having hypertension and diabetes. For these 2 conditions, he is taking medications. lesnopril, levostatin, glipizide. So he is taking these medications currently. So in this particular encounter, doctor has done some dosage adjustment, or doctor has changed the brands from the old visit to example. Previously patient was taking lesnopril 5 mg for hypertension, for diabetes, glipizide 100 mg. So in this particular visit, yesterday he went right, in that visit, doctor has revised the dosage. Lesnopril 5 from 5 mg to 100 mg, glipizide from 100 mg to 200 mg. This was a service done by the doctor in that particular visit. So for these medications, we are not reporting any codes. We are reporting codes for diagnosis, right? So we have to give now an alphanumerical code for hypertension and diabetes. So after reviewing the prescription, the coder will come to know, okay, I have to give hypertension and diabetes. So in ICD, 22 chapters are there, right? So we have to follow that 22 chapters guidelines and we have to report that codes. So anyhow, this is an open book exam, right? So you have to go to that particular chapter from the book. If you're not remembering such guidelines, then you can have, you can view that guidelines from that portion of the book and you can give the answers. So here we have to report two codes for hypertension, I10, and for diabetes, 11.9. So these were the two codes we have to report. For example, for this treatment, okay, for this service, doctor should get $200. So hypertension is $100, diabetes is $100. So all these CPT codes, ICD codes, HEPICS codes, all these codes are updated with some predefined amount in the billing system. One billing system is there. In that billing system, all the codes, CPT code, ICT code, HEPICS code, whatever the code, that is having some predefined amount. So for example, for this hypertension, $100, diabetes, $100. So the medical coder, he's reviewed the medical record and he just given two alphanumerical codes. I10 for hypertension, 11.9 for diabetes. So that is a part of a medical coder. He is just updating these codes in the software. After that, that is the part of, we have to update codes in the software. That is the only work of a medical coder. We have to review the prescription. After that, we have to understand what is the current treatment he got from the doctor, and following the guidelines, we have to give appropriate codes. That was the work. After that, whatever the codes we are giving, right, the coders are giving it, when that codes are popping up in the billing system. So that is reflecting some amount. Okay. So here, for example, for this encounter, doctor is going to get $200 for his service, because for this $100, for hypertension $100, for diabetes $100. This was the bill. So when these two codes are reflecting in the billing system, that is showing $200 each. So in billing system, billing persons will be there. They are the persons, they are sending this bill to the insurance companies. One form will be there, that is CMS 1500 claims form. In that form, the billing people who are working in that department set, they are sending that form to the insurance company. So by seeing that amount only, the insurance companies are giving money to the doctors or hospitals. So what if this medical coder missed to give one condition? Just he gave diabetes. Okay. So medical coder, after reviewing this whole record, he thought, okay, patient is having only this condition. So whatever the reason, he gave just only one diagnosis code. So 11.9. So now doctor is getting half of the money for his treatment, right? Where he has given treatment for two conditions. But as the medical coders, he missed one of the diagnosis code. So now doctor is going to get $100 only. So in that case, again, the doctor will raise query to the insurance companies. So why am I not getting proper money, complete money for my service? What is the reason? So again, the insurance companies are the persons who are giving their projects to the coding companies in India. Okay, whether that is a government insurance company or private insurance company, they are giving their projects to the coding companies. So when they are giving their projects to the coding companies, right? So they made what is that? The primary thing what they will ask to the coding companies means they want 95% of quality from the so and so company. That is the main criteria. So they want 95%. If a company is going to our company is missing to give that 95% of quality work. So they will be doing cancellation projects with that so and so company, or they will be doing some penalties or fines. A lot of things will be there. So quality matters in medical coding than quantity. Because see, if coders are missing these codes, doctors are not getting complete money. If doctors are not getting, they are raising questions to insurance companies. So it affects every of the department, right? So that is why in medical coding, quality matters than the quantity. So what happens if the from client end, if the companies are getting queries and this kind of escalations, they will definitely terminate this so and so medical coder. So in coding companies, a coder should maintain 95% of the quality. If he is not maintaining this quality for 3 days, so he will be having some warnings or he will be in PIP. So that kind of actions they will be taking because quality matters here. So it is not that difficult to maintain the quality. It is easy only. The thing is what for initial few days we have to work carefully. After working for three months or 4 months, the same guidelines we're following, the same type of prescriptions we are getting. So we will know right by that time we can know everything. So during up to that time you have to work carefully for each and every question. If you're having doubt, you have to follow the manuals or you can reach out to your team lead. So they will be helping you in that case. So we can maintain quality. That is not a big problem, but quality matters. So that is the first step. Coders documentation review. Coders review medical records to identify diagnosis and procedures. Next, code assign. So after reviewing this medical record, so we'll come to know, right? So from this so and so medical record, we have to give either diagnosis codes or procedure codes. So from this, see, if it is a procedure prescription means we have to give only procedure codes. If it is a diagnosis prescription means we have to give that codes only. Okay, that is different again. So we have to report ICD codes or diagnosis codes based on the guidelines. That is the second step, code assignment. Next, quality checks. So quality checks, thorough reviews ensure accurate and complete coding. So for the initial 1 to 2 months, okay. So after getting a job for in any company, for the initial 1 to 2 months, the coders are having 100% of audit. Example, a coder is having target of 20 charts. So like this, 20 medical records for 20 patients medical records he have to do on that particular day. That was a target. So for the initial first month, their target was like 20 charts. So whatever the 20 charts the coders are doing it, that all charts are getting QC done by QC team, QC persons in the industry. So whatever the charts they are doing it, 100% quality, they will be in 100% quality. So during this 1 month, if the coders are maintaining quality, like they are getting less errors from out of these 20 chapters, 20 medical records. So for the next month, they will be moving to 50% of audit like that. 50% means what? Again, the target is 20, but out of 20, randomly 10 charts are going for QC like that. If one is maintaining quality, they will be out, they are moving out of 100% quality. So the last percentage of quality is what? 20%. Whatever the target they are doing, 100 or 20 or 130, whatever it is, out of that 20 charts randomly, that is going for QC. The QC will be there always. So if one is getting errors, one is not maintaining 95% of quality in that 20% of audits, so they will be having some warnings or like that things. So if any coder is missing any codes or he has given incorrect codes, so this quality persons, they will correct it and they will submit the codes again. Next, submission. So the quality persons, they are submitting the codes, right? So once the codes are submitted in software, so each company is having some kind of software. In that softwares, we have to submit the codes. So that is the work of a medical coder. After submitting the codes, whatever the codes are submitted by this medical coders, right, that codes are getting pop up in the billing system. So each code is having some predefined amount, right? So that amount with the code in that form, claim form, the billing persons, they are sending that bill to the reimbursement insurance companies. So this is how doctors are getting reimbursement and also hospitals also getting their bills. So far it is clear. Any doubts for anyone?
Yes, ma'am. I have one doubt.
Okay, what is that?
While just correct me if I'm right, if we are finding medical codes in the given case, so we can give codes to the past history only when it is relevant to the current case, right? Where
Yes.
a physician can make the changes or change the dose, or it is related to the current diagnosis or condition. Only when we can give codes to the past history, right?
Yes.
Otherwise, we can't give codes to the past history.
No.
Okay, yeah. Thank you.
Because he's not giving any treatment for that condition right now, right?
Okay, yeah.
In today's date of service, example, patient is having COVID 6 months ago.
Hmm.
Okay, that is the status of a patient. He is having COVID 6 months ago. Now he is
Hmm.
going to hospital with some other problems. So he will be
Right.
asking from last 1 year what and all the problems you're having. So suppose
Right.
patient is telling I'm having COVID. That too 6 months ago. So that thing he will write under this section under PMH. So for his COVID, right now he is not taking any medications or doctor is not giving any treatment, right? So in that case, we should not report any code for that. And
Okay.
coming to this chronic conditions is what? If patient is having that conditions, they will be taking medications for a prolonged
Long time.
period.
Yeah.
So for chronic conditions, definitely doctor is giving some kind of treatment, whether he's adjusting the dose or he's asking or he's giving any diet suggestions, whatever the things he will be doing, right? So
Okay.
that chronic conditions we can pick from PMH.
Okay. Thank you.
Okay, so
No doubts, ma'am. It's clear, ma'am.
okay then. So next is CMS. CMS means what? Centers for Medicare and Medicaid Services. So CMS is a federal insurance policy body in US. This is nothing but an insurance company, government insurance company. How in India we're having that LIC policy rate. So like that, they are having the CMS. So not only CMS, there are other government companies are their policies and private companies that we will see in tomorrow's class. So coming to the CMS, it is again having two categories of services. Medicaid service and Medicaid service. These are the two policies, and these policies are applicable to persons. So coming to Medicaid, that is applicable only for patients with 65 years of age or above. That is one section. And physically challenged patients. This is another section. So this physically challenged patients age may be like 20 years, 10 years, whatever the age. This is one section, this is one category, and this is another category. Next category for this Medicare is ESRD patients. ESRD means what? End stage renal disease, permanent kidney failure that requires a dialysis or a transplant. So what is the main function of kidney to the body? What they will do? Kidneys.
Uh,
Read the waste.
Come again, please.
Impurity filtration.
Okay.
to filter. Yeah, filtration.
Filtration and excretion, right? So the main function of the kidneys is what? Filtration. So where that person's kidneys are fail to do that function. Example, one of his kidney got failed. Okay, one kidney is working normally, one kidney is not working. So he can survive with one kidney. So what if where his two kidneys are not working? Not working in the sense the filtration process that was not done by his kidneys. So the normal filtration rate is 95 ml per minute. So this was the normal filtration rate. So coming to this kidney disease, CKD is nothing but chronic kidney disease. So it is having 6 stages. Stage 1, 2, 3, 4, 5, 6. Okay. So stage 1 means what? That where his kidneys are having problem. So the normal filtration rate is 95 ml, right? 95 ml. So with the CKD stage 1, where that person's kidneys are doing filtration like 80 ml per minute. So because his kidneys are having some disease, if that stage is coming to 6, the stage is progressing from 1 to 6, which is like worsening. Okay. So if it is stage 6 means where his kidneys are not performing the filtration process. If that was not done by the kidneys, that person will die because that is a blood filtration process. So what they will do in that case, that particular person should get dialysis or he should get a kidney transplant in order to survive. So for that kind of persons also, this plan is applicable. That is Medicare service. Patients with 65 years of age or above, physically challenged patients, and ESRD patients. Next policy is Medicare Medicaid service. And this policy is applicable to persons, those with lower income and few resources. So these are the two policies under this insurance. Okay. So this is applicable to these sections of people, and Medicaid is applicable to people with low income. So next one is HIPAA. So HIPAA stands for Health Insurance Portability and Accountability Act of 1996. It is a federal law that protects health information and establishes standards for safeguarding patients' protected health information. So because as these patients are having insurance policies, they are getting treatment from the doctors. As medical coders, we are working on that patient's prescription. See, usually patients, they don't want expose their health information to some other bodies, right? No one will show interest in that case. So I am not interested to show my health condition to some other person's, right? So I want to hide my health information. So HIPAA is the organization that is protecting this patient's health information. So who is having access? What are the parties they're having access? One is insurance company. They're having their patient's health information access. And second one is doctors, because they are giving treatment for the patients. They will be also having this access. And third is what? Hospital administrations. The persons who are in administrative department in hospitals, because they're having, they know the patient's details, right? Like insurance policies details and the personal details. So the transaction details of the patients. So they can also have access to see this patient's health information. And next is what? Coding companies. As coders, we're working in coding companies, we can also have access, right? So these are the four areas where there is a chance to get disclose the patient's information to some other parties. Okay, so in order to avoid such things or frauds, that CMS is the organization that developed HIPAA in 1996. So what is the function of this organization? That is protecting patients' health information. What kind of information? The past, present or future physical or mental condition of a patient, the provision of any treatment or healthcare services to a patient, or the past, present or future payment for treatment or healthcare services to a patient. So they are protecting this information from these four bodies. So what happened if someone is disclosing this patient's information from anyone? That persons may be from insurance companies or from doctors or from hospital administrative services or from medical coding companies. So if they're violating such rules, so this HIPAA is giving this HIPAA is giving severe actions or penalties to that respected persons. So that is why we are not getting the actual live records for viewing purpose. So whatever the prescription it is there, right? This is a dummy prescription. So this is the format. Okay, this is how the prescription format will be, but this is not the actual prescription. We are not having that access to view. So when you're working in coding industry also, HIPAA is a what is that? That HIPAA policy is very serious. If any code is exposing, just we cannot take a screenshot of the prescription also. So that causes a severe, that leads a severe consequences to the consequences to concerned person. So the HIPAA Act is very, what is that? Actions will be very serious. So that is the function of HIPAA. Next, types of visits or encounters. So physician visit, outpatient visit, and inpatient visit. Physician visit means like a clinical visit or office visit or hospital visit. So he can see doctor in his clinic or hospital or office. So where example, if he's having fever, patient is having high fever. So he will be going to a doctor to so and so hospital. So where he is getting some treatment from the doctor, again he is coming back home. So that comes under physician visit. Next, outpatient. If a patient is admitted and discharged from a hospital within 24 hours, that is known as outpatient. So there are some surgeries like a cataract surgery example. So for this surgery, the patient is getting admitted into the hospital and within 24 hours. So morning he's getting admitted into the hospital and by night that patient is getting discharged from the hospital. So for that cataract surgery, it will take 1 day only. Okay, so if that thing is happened, we can say that as a outpatient visit. If a patient admitted and discharged from a hospital within 24 hours. Next, inpatient. If a patient admitted and discharged from a hospital after 24 hours. So that based on the patient's condition again, if he's having multiple fractures, so where he's getting treatment and where doctor is asking him to get admitted into the hospital for 1 week. And where another person he is having severe head injuries, he went into unconsciousness, where he is having clots in his brain. So for that person, the admission, the discharge into, hospital admission, it will take more than 1 month or 2 months. That depends on the patient's conditions to condition. So inpatient means what? The patient admitted and discharged from a hospital after 24 hours or more than that also. So that is about types of visits. Next, types of records. Records are nothing but medical records. So AMR record, handwritten record, and primary care physician record. So this is the example for EMR record. So the format will be like this. In EMR record, what is the abbreviation? Electro medical record. So in this format, we will get EMR means in this format. So it is very easy for coders to review this type of medical records because everything was clear, right? Compared to handwritten prescriptions. We know, right, how that doctor's handwritten will be. So 99% when we are working in the industries, we will be getting this format prescriptions only EMR. But 1% here and there we will be get sometimes handwritten prescriptions also. So that time we have to spend more time because first we have to understand the doctor's handwritten. So after that we have to see what and all the conditions this patient is having, what kind of treatment he is getting. For that it will take more time compared to review this EMR medical record. And next is what? PCP. That is primary care physician records. So these were the types of records. So this is about some basics of medical coding. So tomorrow we will see US healthcare basics. So that we will discuss tomorrow. Any doubts in this part so far?
No, ma'am.
Okay. Have they uploaded material to your LMS portal? Okay, just check and inform me tomorrow. Oh, I'm sharing these manuals, ICD and CPT manuals, both 2025 version. You can take that printouts, hard copies. As of now, so this first module, second module, it will going to take, by this month end, okay? By this month end, you can take ICD manual first. If you want, you can take both at a time, ICD and CPT. Both will cost around 2,500, both manuals, because each manual is having some 14 to 1,300 pages each. So that will cost you like 2,500. So as if now you want to take ICD first, you can take that. So that too, I think time is there. Still, in this time is there. So after that, when we are starting CPT, right, that time you can take CPT manual, or it's up to you. So I'm sharing that both soft copies, ICD and CPT, both latest version 2025. So for CPT, sorry, for ICD, even though that updations are not done, but quarterly updates will be there. Okay, quarterly updates for every 3 months, some updations will be there. That latest updation soft copy is there with me. Again, October 2020, so not 25, October 25, the updated version I will be sharing with you because I think you guys will be there up to that time.
Ma'am, can we have access to this presentation?
I will be sharing that PPT with you guys.
Okay, thank you, ma'am.
So it is not like that we have to take these manuals every year. Who will buy every year? So when you're
Right.
working in the coding industries also, they don't buy these manuals every year. So whatever the updates will be there, right, that updates will get through some websites. You can just Google it, what are the updates for CPT, so and so. Yeah, you will be getting that information. So far when you guys, until, your course completion, whatever the updates will be there, right, that I will be sharing with you. After that, if you're giving the CPC exam for next year, so by that time, These manuals are getting updated, right? So that that information you can get it from the websites. So I have shared both ICD and CPT. If you want to take these both at a time, you can take, or else as if now you can take ICD. So for that also time is there. So by this month end, you can take this manual. So for today's class also, I'm sharing that material. You can go through that one also. Okay then, bye guys, bye everyone.
Bye and thank you, ma'am.
Bye.
Thank
you, madam. Good night.
Bye.
Bye.
Thank you, ma'am. Thank you, everybody.
Thank you, ma'am.
Thank you.
Bye, bye.
Thank you,
everyone.
ma'am.